Okay, we've got a good amount of people. I am aware that we want to keep to time, so perhaps I'll start and people will be joining as I give a brief introduction. So good morning, good afternoon, everyone. I'd like to welcome you to the Girls Education Challenge Discussion Series, which focuses on how the Girls Education Challenge has responded to the significant challenges of COVID-19. I'm Sharon Tao, the Education Director and Team Leader for the Girls Education Challenge Fund Manager. Before we start, I just wanted to cover some housekeeping rules. In the interests of bandwidth, if you could all keep your cameras off and go on mute, we'd be very grateful, unless you're speaking, of course. We also wanted to let you know that we're recording the session. If you have any concerns about this, please do let us know. And also, just to let you know, we're also putting the recording of the webinar on our GEC YouTube channel, which is new. So I think Ellie has just put the link to that in the chat. So please feel free to share that link widely as well. And finally, at the end of the webinar, we have a very brief 3-question survey for participants that really helps us kind of get some lessons learned and improve our practice. So if you could fill that out for us, we'd be very grateful. And I think Ellie will also put the link into the chat. Okay, so that being said, welcome again to the Girls Education Challenge Discussion Series. For those of you who may not be familiar with GEC, we're funded by the FCDO, and the GEC is comprised of 41 different projects across 17 countries, implemented by various organizations and partners. And although there is a great variety in the size and scope of the 41 GEC projects, all of them aim to support the most marginalized girls, either those who have dropped out or have never attended school, or those who may be enrolled in school but who are the most at risk of dropping out. So this discussion series aims to present the GEC's learning and analysis regarding the impacts of COVID-19 on girls and how the GEC projects, the fund manager, and the independent evaluator responded to these impacts in their different roles and capacities. We've had 3 webinars in the series so far. The first was presented by the GEC's independent evaluator regarding their initial estimates of learning loss in Kenya and Nepal as a result of COVID-19. The second was presented by CAMFED, Lena Cheshire, and Plan International about how their projects partnered with government and community networks to respond to the COVID-19 crisis. And then our third webinar last week was presented by UNICEF, Mercy Corps, and Save the Children, discussing lessons learned from South Asia regarding gender-responsive approaches to education at the height of COVID-19. So today is sadly our last webinar of the discussion series, but certainly last but not least. And today we'll be doing a deep dive into 2 COVID innovations from GEC projects based in Afghanistan. So without further ado, I'd like to introduce our chair for today's webinar, Anne Kabade, who is the consortium coordinator for the Stages program in Afghanistan. So Anne, over to you.
Thank you, Sharon. Steps towards Afghan girls' education success and Leave No Girl Behind are 2 Girls' Education Challenge initiatives that are implemented by a consortium of local and international implementers in Afghanistan. The consortium, led by the Aga Khan Foundation, is composed of 5 other partners, including CARE International, Save the Children, Catholic Relief Services, Aga Khan Education Services, and Afghan Education Production Organization, or AIPO. By early 2020, the consortium partners directly supported 298 community-based education programs and supported 236 ALPs through LNGB Plus in 16 provinces of Afghanistan. The most significant change in context for education this past year has been the response to COVID-19. Stages consortium partners have added a rigorous COVID response plan to their activities in Afghanistan, which further adapted their interventions. This work has included interventions with teachers and community members who were invaluable as frontline workers. They were providing remote monitoring and feedback to field officers. Teachers were also trained in new methods of contact, that is mobile and online, which they embraced and managed to keep students engaged while receiving much needed mentoring and support. The stages and LNGB plus narrative in Afghanistan is of particular global interest because it has shown the power of education in changing attitudes. From stages CBE, intervention for marginalized girls coming from diverse communities and ethnic backgrounds, to LNGB plus reach of the most marginalized girls in the hardest to reach communities as well. Partners had to come up with innovative methods for project day-to-day survival and for inclusiveness and sustainability. Linkages with the Ministry of Education coupled by advocacy with community members means the impact of these projects have been far-reaching. We aim to showcase these dynamic interventions in this volatile context for the benefit of other projects operating in our region, and also to share the experiences from the field and lessons learned. The first presenter will highlight how the consortium is working to remove barriers to education for extremely marginalized girls. This includes working with children with disabilities, internally displaced persons, refugees, and different ethnic minorities. Our first presenter is from Aga Khan Foundation. It's Najib Montahez. And I will pass over to you, Najib.
Thank you, Anne. I also welcome everyone to this webinar. I would like to present initiating home-based study practice in community-based education that we implemented this practice through steps toward Afghan girls' education success and through LNGB Leave No Girl Behind, that the projects implemented by a consortium of partners led by Al Khan Foundation and its downstreaming partners, Save the Children, CARE, AKS, CRS, and AAPU. Next slide, please. Why we started this initiative or home-based study practice in our communities, it is because that the COVID pandemic has a biggest hindered threat to education, and all schools were closed in March 2020. It is clear for all that the schools were closed across all the world, but particularly in our communities, we also stopped education for children. Although the school in Afghanistan were in crisis before the outbreak of coronavirus, it was great generally for girls and boys, especially for children with disability, children who live in conflict sensitive area, and IDPs, children are at risk of marriage or they early married. These are the factors that treated the children education in Afghanistan, but the coronavirus became another biggest hinder threat to close education for all schools. So through this pandemic, number of students affected by the school closure in stages communities, over than 20,000 girls and near 10,000 boys affected that they stay at home with no access to education. Next slide, please. Our home-based study practice modalities, we developed some modalities to teach children through these modalities at home. One of our modalities developing home-based study worksheet. We developed home-based study worksheet and disseminated to the communities house by house for the children to study at home. We also requested children parents to teach children at home through the home-based study worksheet, and as well as we requested the community-based teacher to teach children at home through telephone, mobile telephone, that we call it remote learning by phone. The teacher was assigned to contact children weekly basis and follow the home-based study worksheet with the children at home. We also provided self-study. The worksheet was developed in a way that there was some easy exercises for the children to practice at home. That was self-study. We also teach children in a small group based on the protocol we had with the Ministry of Education in Afghanistan. We divided the groups in different shifts in a day, and we teach children in a small group of 8 to 10 children. In addition, we provided psychological first aid support for children. We also provided COVID awareness raising messages and posters and distributed to the communities to make sure everyone is safe from the COVID infection. And as well as we provide the safe distribution guideline and the guideline to keep safekeeping in contact with the girls, as well as we provided personal protection equipment for the children and for the communities in order to make sure everyone is safe and protecting from the infection of the coronavirus. These were the modalities that we implemented through the home-based study practice. Next slide, please. The CARE International in Afghanistan conducted a COVID rapid analysis in Afghanistan in June 2020. This gender rapid analysis show the percentage of students used home-based study materials provided by the project, and as well as percentage of students spent time on studying home-based study materials. Of used home-based study materials, it showed that 28% boys and 91% girls received and used home-based study materials and studied through these home-based study worksheet at home. And percentage of students spend time on studying home-based study, it is divided more than 2 hours, less than 2 hours, and no time. 34% boys and 38% girls spend more than 2 hours a day to study home-based study worksheet. 46% boys and 49% girls spend less than 2 hours time a day to study home-based study practice, and 8% boys and 1% girls spend no time. There was even this is a high percentage that the students received, and also as well as they studied and spent time to study at home. And as well as there was another modalities that some of the provided by the Ministry of Education, that the Ministry of Education teach children through the television, laptop, and tablets. This kind of electronic devices was the Ministry of Education planned to teach for children. Most of the children used from different modalities that was provided by the Ministry of Education. Next slide, please. We also conducted learning assessment in LNGB communities on the home-based study practice in December 2020. This learning assessment result shows that the students in literacy and numeracy achieved or got a high percentage of score. It means that it was effective and beneficial for the children during the COVID pandemic and school closure. In the left slide that you see the table that the grading are divided in categories of excellent, good, fair, poor, very poor, skip. So the range of scoring shows that the excellent is 18 to 100, good is 16 to 79, fair is 14 to 59, and poor is 20 to 39, very poor 1 to 19, and skip 0. So an average that we calculated in literacy, both literacy and numeracy score, the 53% of students achieved excellent, 28% achieved good, 30% fair, 3% poor, 0% very poor, 0% skipped. It means that over than 90% of students achieved and successfully passed this learning assessment with high achievement rate. and less than 10% followed in this assessment that show a high percentage of students achieve excellent, more than 60% score. Next slide, please. We also faced some challenges during the home-based study practice, particularly in terms of distributing and disseminating to the communities. One of our challenges was insecurity situation that prevented us to move community by community and disseminate these materials to the communities. Secondly, lack of additional support for children with disability. We have children with disability in our communities that they need additional support to follow their education. We have not additional support and not provided for them. This was a challenge for subgroup children with disability. Cultural norm and barrier is another challenge in the communities that the community people mostly prefer boys education than girls education. Parent illiteracy is another challenge that we requested parents to teach children, but unfortunately, majority of the community people and parents were illiterate. Lack of electricity causes that children cannot use laptop, tablets, and television. Lack of using technology in learning. In most of the community, we have not access to the internet to use technology. Social restriction during the COVID pandemic. Social restriction was another barrier that prevented us to move area by area and community by community to support the communities and children. Next slide, please. We also learned some critical lessons during the home-based study practice, and we also have some recommendations for future of the project. So one of the recommendations is to support Shuro member. The project has to more invest in community mobilization and community capacity building to make sure community have enough capacity in terms of teaching children at home, in terms of raising awareness in the community to other community people. It is most important that we invest more in community mobilization, that they have more contribution in the communities. Secondly, learning outcome. It is likely that most marginalized gap, particularly those subgroup children with disability, IDPs, children in conflict area, early marriage, they lose time during the pandemic. They need more support and remedial classes to maintain their education. The project should provide some remedial classes for those students to maintain their education. And thirdly, learning timeline, since all the students lose time during the COVID pandemic and they will not be able to complete their curricula. So our recommendation is for the project to extend their cycle for the children to complete their grade by the end of the project. Subgroup children, the project should provide additional support and aid that needed by the children with disability, children in IDP, children in conflict, they are at risk of marriage. The project has to provide additional support for this group of children to make sure they are supported by the project. And lastly, continue home-based study. We recommend to continue home-based study during the school winter and summer vacation to improve children learning outcome, because children lose time during the COVID pandemic, and we need to provide more remedial classes and support for them to make sure they are in line with the Ministry of Education curricula. Next slide, please. That is the last slide. Thank you very much for your attention. I welcome every suggestion and question to my presentation. Thank you, everyone.
Thank you very much, Najib, for the presentation. What we forgot to mention at the beginning is that we are taking questions after presentations have been completed. You may put your questions in the chat, or if you prefer, right at the end, you may raise your hand and we will take your questions you may ask in person. We will now continue. In our second presentation from Norula Obaid, we will share the experiences of mentoring and supporting teachers through a modern initiative called IVR, or Interactive Voice Recordings. Norula, if you will take it from here.
Yeah, thank you so much. To everyone for attending in today's webinar. As you know, during the COVID-19 outbreak, so there was many distractions. We were not able to reach in person or provide in-person training for teachers. Then we have decided to adopt the way of training we are conducting for teachers. Then we have decided to provide some remote training for teachers in stages project in 16 provinces of Afghanistan. Next slide, please. Yeah, digital education in Afghanistan and COVID-19 context, schools were closed across the country from March to October 2020. It means we were not able to provide support in person, and even the project staff, the technical staff, they were not able to provide in-person support for the teachers and provide mentorship and other supports the teachers need. And in many communities, the teachers have very little or no internet access, which means we were not able to provide support through internet access for teachers. And then we have initiated a remote home learning program for students that we have distributed paper-based learning pockets. We have provided teachers support through the phone. And we were not able, as I said, we were not able to provide in-person training. Next slide. Yeah, then we have decided to do the remote trainings with Vayamo. Vayamo is like a company or a social company which provide the public services through IVR or interactive voice responses. This is a kind of computer system which recorded the voice and even the text, and then they can call to the numbers given to them, and even the beneficiary, they can call back to them to listen and to read the text. So the system works with very simple phones, so it means it doesn't need a smartphone. This is why it's very useful, and we have decided to launch this remote training for teachers, because many of our teachers, they were not, or they didn't have the smartphones, and instead they had like the simple phones. Then teacher training, then CRS worked with the Vayamo to create a 12-week module which provided through IVR or interactive voice responses. The topics we have included in this remote training was dropout prevention, child-friendly classes, positive discipline, at-home learning, inclusive education, and psychological first. There are like about 12 topics during this 12 weeks. Training structure, there was like a 6-minute interactive voice responses module per week. And then there was a pre-SMS for the teachers to remind them about the topic of the day. And on week 9, we had a quality check survey to see the effectiveness and impact of the training for the teachers and what they learned and what problems were with the training. And there was a callback number. If any teacher, they missed one of the topics or one of the modules, then they were able to call back to the Vayamo number, and they were able to listen to the missed topics. Next slide. So this is showing like the module format and the call plan. The first one showing the module format, and the second slide showing the second table showing the call plan. On Sunday, the teacher, they received a pre-SMS about the topic. On Monday, the teacher, they received the call or the topics about 7:30 a.m. And then the teachers, they're receiving another call on Tuesday. So it means if any teacher, they miss one of the topics, so they had the opportunity to receive a second call on Tuesday for the missed topics. And there was another call on Wednesday. This is something we call teacher reporting, because the teacher, they had to report back to Vayamo what they learned from the topic or what problem they have. And then on Thursday, the Vayamo had to report the data for the partners. This was usually for the programmatic issues to see the result of the training. Next slide. Yeah, this slide showing teacher engagement. There were about like 1,400 teachers have been introduced to Vayamo to receive the calls or the trainings. So the green bar shows the teachers who engaged, and the red bar shows the teachers who didn't engage. So we can say if a teacher pick up the phone, so we can say the teachers engaged because the teacher pick up the phone and they listen to the topic on the day. But some teachers intentionally, or maybe due to some issues, connection issues, they were not able to pick up the phone, or intentionally they didn't pick up the phone. So if a teacher didn't pick up the phone, we say the teachers didn't engage. Next slide, please. As said, we had a quality check survey on week 9 to check the knowledge retention of teachers. There was like 4 scenario questions. The teacher were responsible to choose the right questions. The question was about the child-friendly classes, positive one, positive discipline 2, and psychological first aid. So as we see, psychological first aid was a little bit low in other topics because it was new for teachers. We think this is maybe one of the factors that the teachers, they were not able to choose the correct answer because this is a new topic for them and they were not much familiar with these topics. Next slide, please. Again, there was like 2 questions. The first question asked from teachers, how effective was the remote training for learning? So we can see like 51% teacher, they say it's very effective, while some teacher, they say it's somehow just 4% of teacher, they say it's not very effective. And then there was another question, would you participate again in a remote training in the future? So we can say 75% of teachers, they say yes, because we think that many teachers, they saw this as an opportunity and they're really interested to participate in such kind of trainings, because part of this remote training also was the hub school or the government school were part of this training, because the government schools, they didn't have the opportunity to receive any such kind of trainings. So then we think that those teachers, they saw this as an opportunity and they were willing to participate in such kind of training in the future. Next slide. Yeah, we have some success challenges and adoption suggestions. Like the success, all the teachers, the teachers' feedback was positive. Many teachers, they are willing to participate in such kind of training, and they were saying it's very effective. Some teachers, recorded the lesson and they listen to that records later or for future purposes. Higher engagement rate among women. This is something very impressive, because at the beginning of this training, we thought maybe we have less women participating in this training, but fortunately, according to the data, we saw that like the family engagement rate was more than men, because I think that this was because the teachers may, especially in the hub schools, they didn't have any opportunity to participate in such kind of trainings. Then they saw this as an opportunity and they have participated and they have completed all these 12 modules. And even there was a strong knowledge retention among the teachers based on the week 9 survey. The challenge, some technical issues. As said, in some cases, the callback numbers didn't work from the WayMo side. And even there was some network connectivity issues, especially in the very remote and rural areas. Only around half of teachers understood how to use callback numbers. So it means some of the teachers, they were not understand how call back to WayMo for the lessons or for the topics they have been missed. Engagement drop throughout the program. So some teachers, they have not completed the topics. So this is another issue. So we have to look why those teachers, they were not interested to complete all the modules during these 12 weeks. So the adoptions using WayMo or other kind of remote training can be supplemented as in-person teacher training, but still we cannot say this cannot be replaced with the in-person training. Consider remote training for school committees and other stakeholders with low literacy, because in the communities we are working, like many stakeholders and the school committee members, they are illiterate. This is a kind of opportunity for them because it doesn't need skills or knowledges or literacy. So everyone, they can listen and they can learn from this kind of trainings, because it is just a very short training. On theorists carried out the light monitoring, which was this light monitoring have been conducted by many staff. So there was some questions we have focused to know. One of the topics we wanted to know from this light monitoring, to know why some of the teachers, they're stopping participating from this training, or why some of the teachers, they were not able to call back to the numbers, and some other questions was included on that on that light monitoring. Also, we think that if we can distribute some visual materials or any guidance before any remote training, which is using interactive voice responses, that could be very helpful, because this gives a picture, a clear picture for the teachers or for some other beneficiaries to be aware about the structure of the training and how they can use this IVR and how they can call back to the numbers if they miss any of the topics. Next slide. Yeah, thank you so much for your attention. This is end of my presentation.
Thank you very much, Nurullah. So through this pilot project, Stages anticipates that this approach will have significant impact on how trainings will be delivered and allow for greater adaptability to address teachers' needs in the advent of similar global pandemics, ultimately adapting this remote training approach into standard education programming. Thank you again, CRS. From there, we are moving on to our third presenter, who will discuss COVID-19 interventions, a mini assessment which we created using IGRA and IGMA, and other interventions for LNGB girls. We have Mukhadeen Khaitov from CRS.
Thank you, Anne. Well, I'm from Save the Children. In my presentations, I'll be sharing our experience during the COVID pandemic and what adaptations we undertook to ensure the activities are continued, and especially girls are reached with educational activities. So next slide, please. So the project is implemented in partnership with 5 organizations as noted by Anne, and it's led by PMU. The duration of the project is from September 2019 to March 2020 with a budget around of 6.5 million GBP. Leave No Girl Behind is a funding window opportunity under Girls Education Challenge, which seeks to provide education opportunities to girls who are extremely marginalized. To achieve this, we are implementing EEP, Accelerated Education Program classes in LNGB project, reaching more than 6,000 girls between the ages of 10 to 16 who are out of school. And we work in 15 provinces, and we are seeking for support from 14,000 community members. Next slide. When it comes to the COVID, I would say it was a gift, and nobody expected this will change the whole world and every single person. To ensure that we contribute to this response and continue our activities at some level and provide on-time support to our beneficiaries and especially to girls education, we have adapted our activities. In response to this COVID situation, the program designed the following activities. Remote learning activities for children to home. We have to highlight the fact that when the COVID struck the country, we have just launched the project, the LNGB, and established the classes. The girls were at grade 1 when the classes went on lockdown, and it was critical to make sure that we make the right decision and adapt our activities so girls continue their education process. As noted by our colleagues, illiteracy is a big concern, and the majority of parents are illiterate, and this also influenced our adaptations. We have adapted our education materials to home-based learning, simplifying it so girls continue their education at home with limited support. To ensure the safety of our beneficiaries and supporters along the home-based learning materials, we distributed health hygiene kits such as face masks, PPE for teachers, sanitizers, and so on. Teachers, as our community agents, were provided with more airtime credits to ensure they keep in contact with students and follow their educational process. We also developed standard operating procedures during the COVID response to ensure teachers, program staff, and field staff follow COVID prevention measures. The lack of access to remote communication means that teachers were the only way to disseminate information on COVID, home-based learning, and by conducting community-raising activities. With regards to the remote capacity building of teachers, one important point also to mention here is that teachers were also newly recruited when the COVID happened and did not have the adequate trainings attended in person. So we also had to adapt our capacity building activities in a way that we continue with trainings of teachers and provide adequate and on-time mentoring. As noted by our colleague in collaboration with Vayamo, we designed remote training using the IVR technology. So we continued training the teachers on different subjects. Psychosocial trainings were part of the modules to ensure that we provide adequate support to teachers and households about their well-being during the COVID. Also, to mention here that we also adapted our mentoring sessions to conduct it remotely and ensure teachers are provided adequate and quality mentoring during this difficult period. With regards to the awareness raising campaign, we used the global COVID prevention and awareness raising materials, adapting it to the local context. We also provided orientation training to the program staff, who in their turn provided orientation to the teachers. Moreover, one of the main part is that we reinforced our hotline system, and it was operating 24/7 during the response. Hotline operators was provided on training with psychosocial support and well-being, as well as ensure the feedbacks and complaints from the beneficiaries are immediately delivered to the relevant staff. Also, the special attention was paid to the safeguarding during the COVID and raising awareness of parents on parenting without violence. As a result, teachers, field staff, and especially parents were continuously provided with child safeguarding messages. Additionally, we have continuously supported our community leaders by providing them remote trainings and mentoring. I would also note that the community leaders played a significant role in disseminating the information and raised awareness of communities during the response. Of course, our community leaders' safety and health was priority for us, and we equipped them with adequate health and hygiene kits and trained them on COVID prevention measures. Of course, during this response, we also did not forget about the back-to-school activities, where we provided the classrooms with health and hygiene kits to ensure the students are back to the safe learning spaces. Finally, we were in close contact with relevant government authorities and coordinating all our activities together. Also, apart from that, health officials, health authorities in the communities also play a significant role in contributing to this challenge. On the M&E agenda, having an experience working in the insecure situation, we adapted our monitoring system to the COVID response. We adapted our approach in reaching out to the beneficiaries to get their feedback and be in contact when required. We changed our usual monitoring to, let's say, remote monitoring. We collected the parents' contacts and have been keeping in contact with parents, students to get their feedback about the education process, about their challenges they face as part of accountability and learning plan. As noted, also the hotline system was operating 24/7. Our program team also revised their approach in ensuring the adequate and quality mentoring to teachers and community leaders are continued. Innovative methods of communications with teachers were established, which was at the beginning hesitantly accepted. For example, teachers established the WhatsApp group to share their experience and discuss about their successes and challenges. This is still continued and is a great resource of information sharing. Next slide, please. So, with regards to the success, with regards to the girls' return to the classes, we have been very cautious and we're expecting that most of the girls will drop out. However, this was opposite and all the girls returned back to the classes. Partly, this can be interpreted as the students and parents understand how the education is important and keeping parents engaged in the child learning process. And this, at some point, I think we should be grateful, of course, for to COVID, that parents realized this. For the home-based learning, it was necessary to check the LNGB whether our home-based learning is successful and working. As a result, and the results show that the result of mini EGRA and ENGBA conducted, it is successful. As most of the parents being illiterate, we didn't expect that much success from the home-based learning. With regards to the remote training, when as it was presented by our colleague at the beginning of COVID response, we were somehow skeptical about the success of this training. However, the results showed that it was one of the great success, and engagement of teachers and community leaders were at high. So as a result of this success, we are continuing to provide the remote training to community leaders after the response. With regards to the community awareness raising, this was also one of the key successes where we believe that community raising activities played significant role in reaching out to teachers, parents, community members with regards to the COVID messaging and back to school messaging. So thank you very much. Any questions, please feel free to type it in the chat box. Thanks.
Thank you very much, Mukhedin, for your presentation and for your insights on our interventions during COVID. Now, our third and last presenter, our fourth actually presenter, is from Aga Khan Education Services. His name is Korban Ali, and he is going to present on the remedial education programs that were provided to government schools in Afghanistan. He will also share on various models adapted for remedial education. Over to you, Korban Ali.
Thank you, Anne. Good morning and good afternoon, everyone. My name is Korban Ali YZ. I represent Aga Khan Education Service in Afghanistan. As Anne said, we provided remedial education programs to poorly resourced government schools located in highly marginalized areas. Today, I will be talking about different remedial education models, their impacts and lessons learned. Insights from my presentation can be used to design education programs for government schools to address the students' learning loss in the post-COVID era. Next slide, please. We use the multifaceted approach as part of the Stages project in our remedial education program. We provided after-school tutorial sessions in core subjects of math, reading, science, and English to primary and lower secondary students. We hired extra teachers to provide tutorial sessions after the school hours. We enriched the school libraries with the relevant reading resources, and we conducted reading competitions to promote reading culture among the students. We also provided, online, offline, and in-person professional development training programs to our own extra teachers, and also government school teachers, with an aim to sustain the project activities after the conclusion. We also held sessions with the community members twice a year. We call these sessions social accountability sessions. In these sessions, a representative group of community members are invited, and the project activities are discussed with them, and then an action plan is developed for improving the project. And finally, we strengthen the school management by establishing school management shuras. We provided training and mentoring to the members. Next slide, please. Our instructional models were a bit different between the core subjects. For reading, math, and science subjects, we targeted the primary school students, especially the struggling ones. We identified the struggling students through different assessments. We hired 2 part-time teachers per school to reach out to 120 struggling students. The class size was from 15 to 20 students, and our program duration was throughout the year. Our session durations were 45 to 60 minutes. The programs were offered within the schools and within donated and rented spaces. The teaching methodologies were active learning and child-centered approaches, and also scaffolding learning approaches. As for the English core subject, we targeted primary and lower secondary struggling students, grades 1 through 9. We also, for this subject, because finding qualified English teachers is difficult, we made the contract more attractive, and we hired 2 full-time English teachers per school to be able to reach out to 120 struggling students. The class size was the same with the other subjects. The program duration was termly. Each term lasted 4 months, and a total of 4 to 8 terms was required for different courses. The session durations were different, 80 to 90 minutes, and the sessions were every day. And the facilities and teaching methodologies were pretty much similar to the reading, math, and science subjects. We used child-centered, task-based, and communicative approaches to the students. Next slide. These are the impacts and activities of our project. So I just leave it to you to just skim over it. Next slide, please. The project demonstrated 31% of improvement in the dairy, math, and science subjects, and 12% improvement on the English subject. We used EGRA and EGMA, an adapted version of EGRA and EGMA assessments for the reading and math subjects. And for the English subject, we used standardized tests. Next slide. Our lessons learned. You know, there are different school improvement interventions across the world. Ours was very successful. We believe that it was very successful. Apart from whatever I shared in my previous slides, we have also received anecdotal reports from the community members and also project staff on the success of the project. One of the success factors in our project has been our direct support to the students. We directly worked with the students, and we hired extra teachers to provide additional tutorial assistance to them. We believe that this extra teacher and extra tutorial remedial approach has been really effective. We used thorough and comprehensive diagnostic assessments to identify the struggling students. We utilized robust outcome learning system, tracking system, to monitor and track the learning outcome of the students. We provided continuous teacher professional development to our own teachers as well as government school teachers. We provided manageable training incentives to government school teachers. We contextualized our curricula and syllabi, the international curricula and syllabi to local context. And our class schedules were really smart and efficient. Students had to come to attend our programs only for 1 hour a day for math, science, and reading. For English also around at most 90 minutes a day. And finally, our relationship building with the local education actors added to the success of the project. Next slide. Moving forward, we are planning to again pilot and compare different models of remedial education programs. We want to adopt a randomized control design approach and provide extra teacher, extra tutorial remedial approach to high populated schools and low populated schools. And we want to compare that with the technology assisted remedial approach, which is again provided to high populated and low populated schools. And of course, there will be some high populated and low populated schools as control group. Next slide. AKES is an agency of the Aga Khan Development Network. We provide quality education programs in the in the least developed countries. Next slide. Thanks so much for your attention and time. Next slide. I must appreciate our donor and partners for their generous support to the project. If you have any questions, I would be glad to respond to your questions. Thank you.
Thank you very much, Qurban Ali, and thank you to all our presenters. Just to mention that it's only been 1 hour of presentation for a whole year of adaptation and innovative project delivery. And we want to give many thanks to GEC and to our fund managers for allowing us to explore these different interventions. Thank you very much. We will now go through questions. There was a question from Susan Destan for CRS. Narula, are you ready with your answers?
Yes, please.
Okay. Go ahead.
Thank you so much, everyone. There was a question, did teachers explain why they thought the training was very effective? According to the light monitorings and survey we had from the teachers say because most of the teachers, they were at home because of the outbreak of the COVID-19, and they had the time to listen to these topics. And another things, the teacher said the topics were very relevant with the context because it was covering some topics which the teachers, they need to deal with the students during the pandemic. And even that some teachers say is because it was a short call for 6 minutes, something like this, and they were able to listen to the call. And even if they miss any of the topics, they were able to call back to the number. This is the response for your question. And another question, someone says, why do you think the female engagement was higher? Because we found that usually the female or the woman, they were at home during the pandemic, so they didn't have any outside works, out of the home works, so they had enough time and they had the opportunity to listen or to take part or to participate in the training. This is why most of the female teachers, they have completed all this for 12 modules because they were at home and they had the time to call to the numbers. There was another question, why was male engagement lower than the female engagement? Because especially in Afghanistan and in very remote areas, when the teachers, they are teaching, instead of they are teaching, so they have some other responsibility. They have to work in the field, so they have to bring like some other items for their families from some of the closest or the nearest bazaar. We found that some teachers, they were at the farming, they were at some teachers in the travel. This is why like some male teachers, they couldn't complete all these 12 modules, which is showing a little bit lower than the female teachers. So there was another question: did you deal with social and emotional learning of children at all? And I mean, for the teachers, I can say yes. We have covered some emotional topics. For example, if any students, they were upset or they were quiet when they come to the class, or in some cases the students, they came late to the class, then the teacher have learned or has learned how to deal with the students, check with the students, talk with the students to see what problems she or he has. In some cases, like for example, may they have some family members, they are sick, so they worry about their family members, how they can take care of well-being of their siblings. This is like some things emotionally. Some topics were covered on this modules, and even there were some topics about the safeguarding under the psychological first aid. For example, if any students abused at the class or at the community, for whom they should report, how they can report, what's the responsibility of the teachers, and in such cases where they can refer the case, or if the students, they need any health services needs or something else or any other support, so where they can refer and who should refer them. There were some topics like this, yeah, covered under the psychological first aid. Thank you so much. If there's any more question, I am ready to answer.
Thank you very much, Narula. We will now go to Najib. I think there is one of your questions that is not yet answered. Most of your questions have been answered in the chat. We've got questions on what tools were used for literacy and numeracy test. What is the significance of literacy and numeracy improvement in relation with overall population? So Najib, in other words, who were our comparison groups and how did we do against them?
Thank you, Anne. Yes, I note some questions that the colleagues put in the chat, and I as well as respond some of the questions. In the chat, one question from Nabi was about the tool used in the learning assessment. We use EGRO-EGMO tools to assess student learning progress after the COVID pandemic, and we make some adaptations to the EGRO-EGMO, that we make a mini EGRO-EGMO assessment in the LGBT communities, that the percentage of students achieved excellent, good, and high percentage. Over than 19% of the students through all population achieved excellent, good, and fair. That it was a high percentage rate of the score that the student was successful in terms of home-based study practice and during the COVID pandemic. This was the one question. The second question was from Phoebe Downing about the facing challenges and teaching younger children and through home-based study practice. Yeah, we exactly face challenge in some most marginalized communities for younger children, because those children were not able to do the practices and exercises we developed for them through the home-based study worksheet. But we make some alternative for those communities. We teach those children to the small group based on the protocol we have with the Ministry of Education and those communities. We provided small group teaching for those children, and we teach them through the small groups. The third question was about Doris tool. I hope I converse them. Yeah, the question was about the social emotional learning. Yeah, we provided psychological first aid support. That exactly it was a social emotional support for the children during the COVID pandemic. And first we trained the community-based teacher, the social emotional learning through the psychological first aid, and then we requested those community-based teachers to teach their children that they are in contact through the telephone communication with the children at home.
Okay. Thank you very much, Najib. The other questions, you have already answered them in the chat. So thank you very much. I will hand over to Sharon, and thank you all for joining us today.
Thank you. Thank you, Anne. And thank you to all of our presenters today for such a rich and interesting webinar. It's been really fascinating, and thank you very much for all of your insights. I am very conscious of time, but just wanted to wrap up to say that this is our last webinar in our GEC discussion series. During these webinars, we've seen some of the very significant challenges that have occurred as a result of national school closures and lockdowns. And then we've also heard about the many ways that GEC projects and the FM and the IE Independent Evaluator have responded. Unfortunately, I don't think we're out of the woods yet, but despite all of the challenges posed by COVID-19, the GEC will absolutely continue to find ways to improve the educational opportunities of the world's most marginalized girls. So I just want to thank everyone for their participation today and throughout this series. Please be aware that we will be launching another discussion series in the autumn, so please watch this space. I know that Ellie has put a link in for that very short and brief survey to help us improve our practice, as well as hopefully the link to our GEC YouTube channel, where you can find a recording and share the recording of this webinar. So thank you again, everyone. Thank you again to all of our presenters, and have a good rest of the day. Take care.
Yeah, thank you so much. Good, bye-bye.
Thanks, everyone.
Thank you.